Did you know over 50 lakh Indians are successfully managing their diabetes with insulin? If you or someone you love is struggling to manage diabetes and have been advised to start insulin, you are not alone. Hello everyone. Today, we'll discuss why insulin therapy is important to manage diabetes and how starting insulin treatment can be easy and smooth. To help us, we have a diabetes expert here. Hello, Dr. Siddu Nikith. Thank you for joining us today. Doctor, whenever you prescribe insulin to a patient, the common question comes into a patient's mind is why insulin? Why their previous medications are no longer sufficient? And what are the added benefits of starting insulin? Could you please brief on this?
First thing is to know what is insulin. Insulin is a natural hormone produced in our body which helps to manage blood sugar levels. So patients who are on insulin, what it does is it helps people to control their blood sugars, and it also helps to prevent long-term complications to our eye, kidney, nerves and other organs. So nowadays with the help of we got a lot of newer insulin devices and very thin needles. So all these things have helped people to have a hassle-free life with diabetes and to better manage their blood sugar levels with the help of insulin.
Thank you, doctor. We've understood that insulin helps to manage diabetes and prevent other complications. But still, while starting insulin, patients are having few more worries such as, how do I inject insulin? Can I manage it alone and feeling awkward to inject insulin in a public place, etc.?
Yes. So we need to make sure that few things have to be taken care before initiating insulin for a patient. First thing is teaching them what is diabetes, what it does to their body, what happens if the blood sugars are not under control, and how insulin is going to do that and how it helps to gain control of their health. Second thing is we have to teach them proper steps of taking an insulin. That is the most important thing whenever we initiate a patient on insulin. We have to show them, we have to ask them to take once or twice before us, and then guide whenever they have any doubt, and that is the second most important thing which we have to do. Third thing is how frequently they should monitor their blood sugars or how to monitor their blood sugars. We have to show them, give them a table or a box like how it helps, when to monitor, how to monitor and all. We have to show them, we have to ask them to do once or twice in front of us and make sure he knows those things. And the most important thing is we have to, what happens or how to manage if there is a low sugar episode. So whenever there is a low sugar episode, we have to teach them how to recognize that low sugar episode first, tell them the symptoms, then we have to tell them how to manage that and how to prevent such episodes from happening. This is one of the most important points which might even cause a significant trouble to the patient, and they might land up in hospital because of that. So we have to make sure the patient knows about this. And first 2 weeks of this regimen or initiating an insulin is very important because patient is new to the molecule, new to the regimen. So we have to guide them whenever necessary. We have to stay in touch with the patient. We have to ask them to come to us frequently, make sure that there is no problem or no complaint from their side, and we have to also teach them everything what he does, what he should know, and then we should go forward.
Very aptly answered, doctor. Like any other new things, insulin initiation can be learned and managed easily. But there are some more fear factors which needs your expert opinion. People have a common perception that injecting insulin is painful. It causes hypoglycemia, weight gain. It needs to be taken lifelong, and sometimes insulin is habit making. Is there any truth in this?
These are the fundamental aspects which every patient who is on insulin should know. First thing is selection of proper needle. So these 40 mm needles or 4 mm needles are very thin. They almost make the process pain free. These are the latest things which are readily available for low prices for everyone, and patients should know about these wonderful things. The second thing is proper technique. Patient should be taught like how an insulin should be taken and what are the sites where insulin should be taken. So this is an abdominal grid which marks the sites when properly placed on our abdomen like this, and this helps for better understanding for a patient. And insulin pens, these should be taken, or insulin should be taken at a 90 degrees angle to the abdomen, so that insulin goes into the subcutaneous fat and insulin is properly delivered and properly absorbed into our body. The third thing is recognizing hypoglycemia early and how to manage it. Patients should be taught about these low blood sugar symptoms and so that they recognize as early as possible, and having glucose bedside or having glucose tabs like hypo tabs with them also will help in managing the thing very easily.
Thank you, Dr. Siddu Nikith, for sharing the facts with us. I'm glad that you have presented in a very clear and understandable way. Surely this would benefit the viewers and encourage them for a hassle-free insulin initiation to manage their diabetes better. Thank you everyone and have a good day.